Okay, so welcome everyone. This is part of our Lunch and Learn. Today we'll be talking about discharge and transition planning. So Sarah and I will be talking specifically about things to think about around transitions and some resources that might be helpful. And we're glad to see everyone here. So again, the QR code is in the chat. If you can take a minute to do the pre-survey. Before we start, just a land acknowledgement that we acknowledge we operate on the traditional, ancestral, and unceded territories of the Coast Salish people, the Musqueam, Squamish, and Tsleil-Waututh nations. And this is particularly meaningful for us as part of the Missing Middle is to acknowledge and work with Indigenous youth and young adults who've been affected by intergenerational trauma and colonialism, and for them to really, for us to meet the needs of where they are. So just to introduce the Missing Middle program, if you're not familiar, the Missing Middle program is a multidisciplinary team aimed at improving the service experiences of 16 to 24-year-olds with moderate mental health and substance use concerns and their families. The goal of the transition and linking to care team, so that is Sarah, who is an occupational therapist, Stephanie, who is a psychiatric nurse, and myself, Otto, who I'm a social worker, is to build healthcare providers' capacity and understanding of the population through consultation and education. So we don't provide direct clinical care, but we do want to support your work through consultation, education, and resourcing. Our hope is that our education will help ease the transition process for young people as they go through their developmental and mental health journey.
Yeah, and for some of you joining today, you might know our team from some partnerships we're currently doing. Since we're quite a small team, we started out as a demonstration project, so a pilot project. So we've been working with specific communities like Richmond, Coast Mental Health, and the Carlisle Young Adult Unit, as well as Phoenix Substance Use Center. And then over time, we're looking to expand so that we can support more teams in more areas. But just to note that at this stage, we are not a service that services every team in BC. We're looking at continuing to expand and build partnerships. So just a little more about us.
And one of the things we've been doing is actually sitting in on team rounds and meetings, particularly in Richmond, as we're trying to focus on the adult system to hear about their experiences and if they have youth and young adults on their caseload. So today, the learning objectives for transitions and resources. Number one, to identify the key elements of an effective transition plan, including transition between services or transition from child and youth to adult services. And it would be great to also get your experience and input around transitions. To demonstrate understanding of the importance of patient and family-centered care and how this applies to transition planning. Number three is to discuss how to seek out and develop resource lists to support your practice. And number four, to review key resources around transitioning and supporting emerging adults 16 to 24.
Awesome. So just to get started, why is transition planning important? So we know that any service transition, but particularly that transition from child and youth to adult mental health services, is a really vulnerable time for emerging adults in the health system. This is probably the main thing we get consulted about in our work for a good reason. We know that the highest rates of service disengagement occur in this age group. So a lot of young people, once they leave high school, MCFD, or child and youth teams, once they're an adult, it can be a lot harder for them to stay connected to a service. We also know that psychosocial and brain development continue into the mid-20s, right? With the frontal lobe closing around age 25. And so we know that someone is continuing to develop and may be continuing to experience big ups and downs in that time. And that can be further exacerbated by things like developmental disabilities, traumatic events, substance use, and mental health, which we know can impact their developmental stages and how quickly they progress. We also know that there's a big difference in service offerings and expectations of independence between child and youth and adult mental health services. We recognize some of you are coming from different regions of BC, but it is a big theme that we have heard from teams around BC that, you know, sometimes a child and youth team model with a lot of outreach, counseling, wraparound supports looks quite different from an adult mental health team, which is often more focused on severe persistent mental health, case management, and some young adults that are turning 19 might not necessarily fit the mandate of some typical adult mental health teams. We also know that they're undergoing many other transitions during this time. So I already referenced finishing high school, where they might have a lot of supports around education plans, around school counselors, and losing that stability and that routine, losing MCFD supports if they turn 19 and they're not continuing on with the SAGE program, which we'll talk about today, and then increasing their independence. It's also important to be aware of how discharge or transition from services can lead to increased anxiety and feelings of rejection for youth. I'm sure a lot of you are nodding hearing this, but we know it can particularly be true if youth have had a history of unstable supports and now feel they're losing one of their key sources of stability. So sometimes we might see a young person about to get discharged from a hospital program or from a community program, and you might see an increase in their symptoms or behavior escalations in those weeks before, a large part of that related to the anxiety about that transition and that change.
And just want to add, so one of the education modules we're developing now for May is on loneliness. And some of the research and experiences of emerging adults is they're more at risk of loneliness during a transition period as well. So it's something to keep in mind when we look at really part of the missing middle experience.
So like I referenced, some of you might know about the MCFD SAGE program. So it's been being talked about for decades, the challenge of youth that are aging out of government care when they turn 19, sort of dropping off a cliff or, you know, losing housing supports, funding supports. And so in response to this, MCFD has developed the SAGE program, so Strengthening Abilities and Journeys of Empowerment. I always forget what it stands for. But this program supports young adults who have been in government care for at least 24 between the age of 12 to 19. And this support can continue when they turn 19 up until the age of 27. So I won't go really in depth with this, but like all of our education, we will send out our slides and a recording if you want to look at this graphic in more detail. But some key things to highlight are support with ongoing housing, which we know there's a lot of gaps for young adult housing and affordable housing around BC, also around financial support, mental health and wellness. And a big one is life skills training, you know, helping them build some of those adulting skills, those life skills. If you're ever not sure if a client is eligible, there is no harm in reaching out to MCFD to advocate or see if they might be eligible as well. But it's important to get that set up before someone is turning 19 if possible. So transition planning, that transition to adult care, this table just shows some of the key 4 components for a successful transition. So we know every young person looks different, has a very different family situation, you know, community connections, different teams they're working on. But these are 4 key pillars that help with any transition. And we'll walk through them in more depth on the next few slides. So starting transition planning early. In a short-term setting, so say you're in a hospital or in an acute setting, or a short-term community acute team, that might be just upon admission. You start discharge planning as soon as you start working with them. In more long-term settings, that might be more like starting 6 months or even up to 2 years before aging out. There's really never a time where it's too early to start transitioning and planning for their transition. A lot of the transition to adult care tools available are for anyone 12 and over. So supporting a young person in those years at building up their independence and management of their health is a great time to start at any time, but any time after the age of 12 usually. And again, if there's more complexity, say there's neurodivergence, developmental delay, or a lot of complex social barriers, starting earlier as well, because it may be more difficult for them to transition. And creating an individualized plan. We know that everyone's different and a one-size-fits-all solution won't work for this, right? So there's lots of ways where you can assess their function and transition readiness. One of our favorites is the Transition Readiness Assessment Questionnaire, or TRAQ. We'll have this linked at the end of the resources of this presentation, but you can see a little screenshot down there which shows some questions that are asked on it. So, do you keep a calendar or a list of your medical and other appointments? Do you tell the doctor or nurse what you are feeling? Do you make or help make medical decisions pertaining to your health? Do you attend your medical appointment or part of your appointment by yourself? So these are really helpful data points to start to get a sense of where they're currently at, and it can help with goal setting in your sessions around what are some things that they might want to start working towards to build up that independence. In your sessions with them, you're always assessing so many unspoken things, right? But it can be really helpful to assess their motivation and understanding of their well-being. So, asking them to share back what the plan or the session takeaway is. I'm sure that's something a lot of you do already, but it really helps also get a sense of their insight and what they know about things like their medication, for getting a sense of, are they going to need a lot of reminders from their family about this or from you, or is this a thing that they're taking on and really taking away from the session? I'm seeing a question in the chat. Will the recording from this session be available later? Yep. We always record our sessions, and we also send out the slides. So no worries there. We will send out an email to everyone on our mailing list about that. And if you didn't get a copy for any reason, or you've missed being on our mailing list, you can just send an email to Missing Middle. We have our email at the end of the presentation, and I'll just pop it in the chat as well. Just put it in there now. We're planning to send that out this week. So if any of you don't receive a follow-up email this week, that might mean you're not on our mailing list yet and someone's forwarded you the invite for this education. So feel free to email us if you want the slides or you want to be on the mailing list. There we go. And then involving the client, family, and any other relevant stakeholders. So involving the GP or the NP, if they're lucky enough to have one. We know that there's shortages in BC, but we also know that that's a really helpful bridge between transitions between teams, because that person will follow them through. We also know for some young people that are accessing services at Foundry, they might be getting their primary care at Foundry. And so again, linking in there with the GP or NP who might be supporting from that end. MCFD, and then the sending and the receiving clinicians. And then lastly, identifying potential receiving teams and supplementary resources or services. So you'll notice some of the things we're talking about today, they're not new, right? I'm sure a lot of you are doing these things already. And so just to give everyone a foundational sense, we're giving a combination of some kind of foundational things and then some newer resources or things that might add to the practice that you're already doing. But we know that in the adult system, there might not be a team that magically offers all the things that young person needs, right? It's less of a wraparound team as some child and youth teams. So it might be splicing together a few different services to get their needs met in the meantime. So will they be needing ongoing counseling? Any sort of recreation opportunities, employment supports, school supports, things like that. Another great resource is if they are going to any sort of college or post-secondary, there are often resources and supports, particularly mental health supports through those schools, which is, for missing middle youth, that's a really common resource where a lot of them will tap into that.
And just wanted to add, Sarah, the point about motivation, One of my favorite questions from brief intervention planning, they have this great question when someone identifies a goal or a need and a plan to do it. One of the questions is from 1 to 7, where 1 is very little confidence that you're going to achieve this goal, and 7 is very confident that you're going to do it, is to gauge their sense of confidence in what they might want to do. And, what the research is around the brief intervention plan is if it's below a 5 of confidence, usually that's when people don't really follow through. So one of the questions that's asked in brief intervention planning is, what would it take for you to maybe increase to a 5 out of 7 confidence? And that's where you can look at some barriers or some beliefs or some resources to help the person achieve that goal in the plan.
So step 3 is provide support before transition. So with that team that's currently working with them, providing that client and family education and peer support on what to expect in the adult system and how services might differ. So I've talked about a little bit of this already, but letting them know about often a shift from a counseling to a case management focus, increased independence expected with appointments, and also understanding with the specific team you're referring to what that looks like. We sometimes hear that teams in child and youth system and adult system don't talk to each other as much. And so sometimes they're not too sure about what that service can provide. And so wherever possible, giving really realistic and accurate expectations for the young person and family about what to expect. Recommending they attend the St. Paul's Transition to Adult Care workshop. So we have this linked at the end, but St. Paul's offers these virtual workshops for anyone in BC, for caregivers or for young people on the transition to adult care. These workshops are not specific to just mental health. They can be for any condition. So they're not diagnosis specific, but there's lots of really relevant information around them for a young person transitioning in the mental health and substance use system. And their website also has lots of resources for young people and families as well. So that's also linked at the end. And discussing rights as a consumer of services, right? Empowering them and letting understand, what their rights are. And as they're building this independence, it might feel scary, but it also might feel exciting. A lot of young people feel really ready and they really are looking forward to building more independence and being able to take ownership over their health. Where possible, gradually reducing the frequency and degree of supports leading up to the transition to adult services to support independence building. So you'll notice we say where possible because we fully recognize some of you might be working with an 18-year-old and they might be in complete crisis or experiencing a lot of really challenging things and quite at risk. And so obviously that might not be the client that we pull back and say, oh, let's just do set every 2 weeks, or we recognize that there will be some young people that might be getting pretty comprehensive care right until they transition, but where it is appropriate, working with them on, hey, maybe we can start bridging or scaffolding a little bit, like maybe we work on you starting to get to appointments on your own rather than us driving and picking you up, or maybe we start working towards a session that's a little bit less often, because you are building a lot of these skills and working on them between sessions. So any sort of reduction like that can really, really help them feel more confident going into the adult system. And some other things might be strategies to remember appointments, transit training, advocating for their own needs and appointments. Another resource we have I believe it's at the end, but a lot of you might know about it already, is Recovery YVR has these really great workshops on lots of mental health topics, but one of them is called Talking with Your Doctor. And it's a workshop all about how to be a self-advocate when in an appointment with a doctor. And again, those are free workshops, they're virtual, and they're also in person. So a really easy thing for anyone in BC to access if they want to get more information on that. And then supporting development of life skills. So Otto mentioned I'm an OT, so I'm all about function and life skills. And if any of you have occupational therapists or recreation therapists, support workers, youth care workers in your teams, those are really great people for working on building life skills with them. Things like transit training, things like do they know things about budgeting, about working on a resume, but all of those elements. We're also seeing a lot of teams build in more life skills groups. So in a lot of child and youth teams, we're seeing maybe just like how there's coping skills groups, there might be more of an adulting group or a life skills group. There's a really great group in Richmond called Adulting 101, which is really popular, and the name's pretty funny, but people of any age, especially in the mental health and substance use system, need life skills. And so similarly, running life skills type workshops in the adult system is hugely successful as well, and will really help catch some of these young adults. And then where needed and where possible, provide a warm handover to new service. We fully recognize a lot of you are busy, have big caseloads, and not in every situation will this be possible, but where needed or where possible. So if it's a young person who's, really vulnerable, really anxious about the transition, quite at risk of falling through the cracks or maybe dropping off from service, that might be the kind of client you really want to prioritize with doing some warm handover, whether that's having a meeting with the new clinician and the previous clinician, or having them accompany them to the new service so they can go and take a look around and get front loaded. So anything like that is always helpful.
Oh,
Can you move to the next slide, Autumn?
yeah, here we go.
Awesome. So the last step is providing support after transition. It sounds obvious, but we now know that there's a team who's received this young person. So where able, the receiving adult team may provide more initial support for a young adult and gradually reduce this with time. Any adult clinicians on the call, we know that you carry big caseloads and you're managing people throughout the lifespan. And so a lot of adult clinicians we work with say, I don't really feel specialized or really confident in supporting the adults that are coming into our team. And I'm just recognizing one of the biggest things is it can take a bit more time to build trust or rapport. And so it might be that it's a little bit more support at the start, but you can absolutely gradually reduce that as they get comfortable in the system. And starting that at the start will often save you a lot of time later. Meeting young adults where they're at and supporting continued development of life skills, particularly around housing, finances, school, or employment. We have some resources linked at the end around a lot of these areas. So things like Foundry Works or lots of other vocational programs, ways for them to get support. We know that this age group is often really trying to consider, is it school, is it work? What are they hoping to do next? And then, as we've talked about, supplementing with other community or private pay services is needed. We don't talk about it often, but there are some, like sometimes I forget to ask someone if they're open to private pay, because there are some families and young people that have the means and would opt to do that. And that does take a bit of the strain off the system, but it also often means they might have less of a wait list. And so never being afraid to ask that just to check, because sometimes you'll be surprised with the priorities of the family, and some of them may be wanting to do some private pay as well. And I'll pass things over to Otto to run a bit of a case study with us.
Thanks, Sarah. So we're going to look at a case study and also invite your participation around ideas about the client. So the case study is about Gertie. She's a 18-year-old female that's turning 19 in June 2025. She's currently connected to a child and adolescent mental health community team and has a case manager, an OT, peer support worker, and attends a local youth clubhouse where she participates and volunteers once a week for events. She has a diagnosis of social anxiety, depression, and ADHD. She's currently taking medication for ADHD and depression. Gertie has difficulty organizing herself, planning, and has increased anxiety with changes and needs time for transitions. Her parents are somewhat supportive with getting her medication and to appointments, but she also has a younger sibling with cystic fibrosis that takes up a lot of their time. So we invite everyone now just to think about what some of the challenges that you might foresee with Gertie in the next 6 months before she turns 19 and as she transitions into the adult service. Assumptions are okay. So if you like to just type out some ideas in the chat, we're going to do something called a chat blast. So we want you to type out some ideas, but to not hit send until everyone's ready. So we'll take a couple of minutes. So just share with us and type out some thoughts about what some challenges Gertie might experience in the next 6 months before she turns 19 and during the transition. And
maybe what I'll do, Otto, if you want to go back to the previous slide so people
sure.
can reference the information about Gertie, I just popped the question in the chat.
Okay, great. Thank you. So we'll give everyone a minute or two to just think about Gertie and what some of the challenges she might face and some issues that might come up around transition. So Sarah, I can't see the chat when I'm sharing my screen, full screen. So if you're able just to read out some ideas.
Yeah. Once we finish the chat blast and we ask everyone to hit send, I'll definitely read them out for you.
Thank you. Okay, maybe another 30 seconds and then we'll look at what everyone comes up with.
I also made fun of Steph for picking the name Gertie for this because I don't think I've ever met an 18-year-old named Gertie. I think maybe I've met an 85-year-old named Gertie. But I've also been told from a lot of Gen Zers that names that are kind of old traditional names are coming back in style. So maybe we will start to see some Gerties soon.
Yeah, they are. Okay, so on a count of 5, we'll ask you to hit send. So 1, 2, 3, 4, send. Let's see what everyone came up with.
All right. So Michael is wondering what kind of care is she giving to her sister with cystic fibrosis? Really good point. So kind of getting at is she in more of a caregiving role, and is that an important thing to consider with everything else she's doing? Christopher's thinking about increasing need for independence and autonomy in context of ADHD diagnosis. For example, executive functioning challenges or organizational skills. Definitely. Manjinder talked about scared of meeting people, losing track of her appointments, missing services to take care of her mental health. Maggie mentioned she may be getting a new OT, case manager, and peer support worker, which is a lot of people to get used to, especially for someone with anxiety, definitely. And Otto, feel free to jump in if you want to comment on any of these further. I'm just kind of reading them out one by one.
Sure.
Getting enough support and attention from her parents. Yeah, definitely. We hear a lot about what's the term, the forgotten sibling, or if
Yes.
the other sibling's experiencing a complex medical, sometimes we see a lot of mental health symptoms in the other sibling because they're feeling a bit neglected or going through their own things, but feeling like they don't want to burden their family with it. Natalie talked about ADHD, appointment attendance, medication compliance, many supports going into limited adult supports, increased reactivity or dysregulation with big changes, time dedication to sibling, maybe not enough time to help self or do self-care. And Michael asking, will she be putting this on a resume? Is that your question, Michael? Will she be like what sorts of things will she be wanting to put on a resume if she's
No, I
wanting to look for
was
work?
thinking specifically of the caregiving, and I wasn't fast enough because I was looking for the question mark for taking care of her sister. Sort of.
That's a really good point.
Looking for another type of transition, I guess, into employment.
Yeah, and we know that a lot of young people work a lot of roles like respite or support worker. So you're super right that that family experience is hugely relevant for that if she doesn't maybe have any formal paid or volunteer experience.
a lot of people have gone into the HCAP program for training care aides and also training people to be mental health workers that have had that type of experience that got them into the thing in the first place.
Excellent point.
Definitely.
So thanks everyone. Some really great observations and points. So just to summarize a little bit, and many of you mentioned there's increased anxiety with a looming transition. There might be some attachment to current providers. Definitely what we see a lot in youth and also adults is anxiety about uncertainty, the ability to manage and integrate a new routine, ability to integrate new information. So many of you talked about multiple caregivers, appointments, locations, dates and times, receiving less hands-on support or follow-up. And some of you mentioned also just the culture of adult care and services, what that might look like and the expectations, and exploring limits. Gertie may see herself as an adult and refuse services. So really kind of pushing her independence and making choices for herself. And I think some of you might have mentioned, or what we're talking about also is oftentimes mental health services are really developed more for neurotypical people, from appointments, intake, the structure. And we know that part of the missing middle or young people who might be more neurodivergent, so they might have different ways and different needs to participate in care.
I wonder before we move on, just because that discussion was so good, and I think we have time, maybe a bonus question, but I think we hear a lot when we do mental health substance use work that we focus a lot on what's not going well or what the challenges are. And I'm wondering if any of you, we won't do a chat blast this time, but I'm wondering if anyone wants to pop in the chat or unmute, if you can think of any potential like strengths or protective factors that we can build on with Gertie that will be real assets in her transitioning to adult services. So it's okay if we don't know them about her yet. You can make them up, or you can ask about things you might want to learn more about. But what might be some things that could be strengths or like pillars to build on that will help build that confidence and help her have a good launch? Yeah, so while the parents might be busy with the sibling, they do remain involved, and it sounds like they're supportive. Absolutely. Um, Attending more function-based programs at the clubhouse. Yeah, exactly. So she's already kind of been connected in with a youth clubhouse, and so she's shown interest and openness to going to community groups, and there we know there are a lot of community groups offered. So if she's aging out of this particular clubhouse, Foundry and lots of other places might be offering similar types of services that she might be open to, for sure. Definitely. We also know she has had that diagnosis of ADHD and has medication prescribed. And we know a lot of young adults in the missing middle might be an adult with undiagnosed ADHD or other neurodivergence. And so it's helpful to know that she has had that assessment and is having the medication and knows about that aspect of her, so that she can continue building on strategies and accessing resources and communities around ADHD. And we have here dependability, attending community groups, creating a schedule for appointments, self-care, and time with parents, sister. Totally. Those are all sorts of really positive things that we can encourage her to keep building on. Thanks, everyone.
Great question, Sarah. Really great responses. Okay,
and just
so
one last one came in now
Oh.
from Michael. The parents could be attending parenting groups that exist in Fraser Health so they can get support.
Wow, excellent. That's actually going to be part of the transition planning. So really great point on that. And also relates to our next slide, which is patient and family education. So when we looked at some feedback from patient and family partners, many of them spoke about how they might be aware of resources and strategies, So it's important for us to not assume that they might not know some resources or the process of managing care. So it's important for us to first ask what's been tried in the past, what's worked and hasn't worked, and to build on these strengths by exploring new options together as needed. So some questions that patients and families have really appreciated is validation. You're doing a great job. What do you need? Or what are you hoping to achieve? And another thing they talked about is to not just simply be given a handout or pamphlet with resources, but to help them walk through handouts or resources with them and personalize when possible to meet their needs. One of the things they've commented was it's discouraging just to be handed a pamphlet or just to be told about a website. So really to maybe explore the resources with them, invite them to ask questions or to have a conversation. The third point is to ensure that patients and families are able to receive education on diagnosis and treatment and to help correct any misconceptions or concerns they might have. Especially considering we only know what we know and we don't know what we don't know. So sometimes patients and families might have expectations, but they've never really gone through this path. So it's really important for us to help them understand what to expect. And lastly, if there are any key strategies or coping skills you have worked with them, to ensure that they're written down or provided to them in a way they can reference later. And when you've been in crisis or when you've been in a situation where there's a lot of stress and anxiety, our retention isn't always great. And if we can appreciate that when patients and families are dealing with a crisis or struggling to get care, they might have a lot of information or things on the mind. So it's really important that we really help them retain information by ensuring that we email them or we write down some strategies or coping skills or resources. So understanding resources to seek out and help develop resource lists to support your practice. So many of you are probably aware there are some really good evidence-informed websites for young people and families seeking further information and resources. To offer connection to system navigation supports and family supports as needed. So you might be familiar with the Indigenous patient navigators and discharge liaisons within hospitals. Family Smart is a really great program where they offer family support. And BC Schizophrenia Society, they also do a lot of really good psychoeducation, not just on schizophrenia, but a lot of the major mental illnesses as well. Kelty Mental Health has a really great website with videos and a really rich resource library. Supporting Families in Richmond, for those of you in Richmond, they have really great drop-in and peer support and parent coaching. And Here to Help BC is a really great website. They also have psychoeducation in different languages as well. We can always ask our coworkers and team if they have existing resource lists. So we all sometimes have our little pocket of resources, and it's always great to share that with colleagues. Many websites will also have existing resource lists, such as Pathways, Autism BC is really good, Child Health BC. And here at the Missing Middle program, we've also developed resource lists for clinicians on topics such as housing, family resources, and substance use resources for youth and young adults. And you can access some of these resources on our Missing Middle team site, or you can reach out to us if you're interested. And over time, many clinicians will develop a resource library of their own that really pertains to your own unique practice area. And as we know, resources keep changing. There's always new ones and other websites might close. Sarah just found out recently that I think Anxiety Canada, unfortunately, is closing their website because of funding issues. So this is an example of a template that might be helpful for you to use. And so I'll go to the next slide where there's more of a description. So, for example, the columns look at when to contact, and so you might have different columns. Like, for example, Foundry is made up of community-based health and social service centers for adolescents and young adults. Referral protocol, is it self-referral, or do you go through the website, or do you book an appointment for intake? Contact information, differentiating categories, so they might be very specific to a population served, and different lists of what sort of services are provided and delivery method. And more, you see there's in person, but there's really a lot more virtual care and virtual support. So just to summarize what we've talked about. So today we looked at transition planning, where transitions are always more effective when they're planned. We looked at a resource template where you can create your own resource document for your clinical site. A resource example, and it's what we just saw, an example of a resource template that the TLC team uses. And Sarah will go over some Richmond resources for everyone. Not just Richmond, but the broader community as well.
I think that's an old typo from when we did a Richmond specific education session. But yes, the resources are BC-wide for this one, so not to worry.
Yeah. And in our previous education workshop, we looked more at discharge planning and safety planning.
All right. So in terms of some resources, for those of you that attended some of our other education this month, we did have a discharge and safety planning session as well. Again, it'll all be recorded, so we'll send out recordings and slides for all of these in case you missed anything. So I won't go super in depth into these resources just because we didn't talk about discharge and safety planning. But just one thing to highlight is the Help for the Hard Times workshop through Family Smart. So like Otto mentioned, Family Smart, as many of you probably already know, they have lots of great family peer support workers, but they also offer a really great workshop called Help for the Hard Times, which is specifically designed for family members of a loved one who has been admitted to some sort of a inpatient unit or emergency department for mental health. So if there's been a young person that's been hospitalized for mental health or substance use, their family can access this workshop, and it's a really great way of the family connecting with other caregivers and family peer support workers to understand about how can they keep their loved ones safe at home, how can they process this stressful time. So really, really amazing resource there. We also have some information here around transitioning Aboriginal youth, which again is more in the context of discharge planning from hospital, but might be relevant to some of your settings as well. And Compass, we always talk about it in every education session, but Compass is a BC Children's Hospital resource. Anyone, anywhere in BC, any clinicians, could be peer support workers, physicians, allied health. You can call their line Monday to Friday and connect to get support around anybody 0 to 25 with mental health and substance use concerns. And their team has allied, they have physicians, they have a whole team. And so they're really excellent at providing other guidance and clinical resources for those needs. You can go to the next slide, Otto. Transition planning. So we talked a bit about transition readiness assessment questionnaire track. So again, that's just an easy way to access the questionnaire that can be filled out. The thing above it, My Transition app, it's a really great app that's actually Canadian. It's by CanChild. It's a free app for patients 12 to 18. And they can probably use it after age 18, to be honest, but you can check on the app. but it's a app to help them prepare for that transition to adult care. So actually within the app, they can take the transition readiness quiz and get their results in the app. They can also build goals in there around what they want to work on and track those goals. There's also places in the app to track their appointments, their medical information, and the names or contact info for their practitioners. So a really awesome resource for any young person that you're supporting as they're about to age out, or if they've already aged out. We've talked about St. Paul's. So again, they have those transition to adult care workshops for ages 16 to 25 in BC. And at the end of this slide as well, I've just linked their general website because they've got lots of great resources for youth and families on what to expect with the transition that families can go through on their own. We have that UBC CPD course, so transitioning to adult care for youth with chronic health conditions and disabilities. Again, it's not specific to mental health, but we know that there's a lot of overlap there, and mental health often is a chronic health condition. And we also know that a lot of young people with medical complexity or physical health might also be experiencing mental health. So some really great resources in that course. We talked about SAGE and just a few other resources in here. The track or the On Track program, the transition to adult care through BC Children's, put out a lot of these great checklists for youth, families, and clinicians, again, for helping them get ready and prepare for adult care. And our team is currently in talks with some other teams at Children's about potentially developing some more mental health specific checklists for the On Track. So stay tuned. Hopefully that will be out, but the existing checklists they have are really excellent for youth with any diagnosis. And just briefly, some life skills development resources. This is not an exhaustive list. In some of the resources our team has, we have developed, we have like a spreadsheet that has some other life skills resources as well. But again, a huge area to think about with this population, right, is supporting them with building some of those life skills as they're starting to build their independence. I wanted to give a big shout out to Ali from Richmond. She's an OT who is the one that started up the Adulting 101 group in Richmond. And it's, again, like we talked about, been really successful. So if you're in a different setting or community and you're interested in maybe starting up an adulting type group, her email is in here as well if you wanted to reach out to get an understanding of what sorts of topics she covers, or if you wanted any guidance on, what's worked, what hasn't. But there are, like Natalie had mentioned in the chat, it sounds like through RAS and Foundry, there's a group being run as well. So lots of people to kind of build on, so avoiding starting from scratch, and hopefully you can connect and get some ideas for that if that's something you're keen to do. And the Foundry Work and Education program, we often hear people thinking that Foundry Works is only for those that are seeking jobs and work, but they can also support with stuff around school and school readiness. And so good reminder that that's a really, really great resource, typically run by an occupational therapist, which it can be a really helpful person. I'm a little biased, but in this stage of life in transition, yeah, it can be very helpful to get some of that support around work and school. Right. So with that, we are at the end. We just have a post survey, which we'll put up on the screen. And we have about 8 minutes as well if folks wanted to talk about anything else, share any other resources they have, or if they wanted to ask any questions. So I'll end the recording here, but feel free to stay on to complete the post survey. And if you want to chat or have any questions, we're happy to stay on until 1 o'clock.